Within the simple intensive care study's research structure, we use repeated physical examination and ultrasonography to assess hemodynamic function in the critically ill. The main advantages of this protocol is that it's non-invasive and fast, and it can be performed by trained novices.
Although this research method can be used to get insight into tissue perfusion, the simple intensive care research structure can be used to answer other research questions in other departments or other hospitals.
Generally, researchers new to this method may struggle. Obtaining the images requires practice, although imaging becomes easier with time and training.
The demonstrator of this protocol will be PhD candidate Bart Hiemstra, who is also coordinator of 6-1, and the patient will be Hidde Pelsma, one of our master students and a junior researcher.
Before starting the examination, put on a plastic apron and non-sterile gloves after disinfecting the hands and wrists with 70% alcohol, according to standard hospital procedures. If the patient is conscious and adequate, make an introduction and ask the patient for permission to conduct the examination. After explaining what is to be performed, register all of the vital signs and the appropriate ventilator settings according to the protocol from the available bedside monitors. To determine the subjective skin temperature, palpate the extremities with the hands to estimate whether the patient is cold or warm. To evaluate the peripheral circulation, assess the reperfusion of the knee and sternum by pressing on the skin for 10 seconds and letting go and counting the number of seconds until full reperfusion, and by measuring the peripheral.